Our beautiful patient is here from Boston, Massachusetts. She's had 2 prior facelifts. What I'd like to do is point out something about her prior incisions. A lot of times patients are worried about their scars and how their ears are going to look after surgery, and that's a very valid concern. Our patient is a perfect example of how these incisions can really distort the normal anatomy of the ear. So one of our biggest goals for tomorrow is to really restore normal anatomy, normal incision design around the ear. If we look behind her ear and in the neck area, we can see a very wide hypertrophic scar. This is an example of what happens to these incisions when they're closed improperly and closed under a great amount of tension. The normal anatomy of the tragus, which is a very important feature of the ear, has been blunted and camouflaged by improper incision design. We've really got to revise these incisions such that they look as normal as possible. We can see that her incision was previously placed too far back on the ear itself. She's got something called a pixie ear. So if we look at the angle of the earlobe, it's attached and it's pulling forward. That's a very telltale sign of a facelift. The earlobe should be slightly set back from the normal pitch of the ear, and that avoids this pulled pixie ear deformity.